And welcome back. Well, about 6 to 8% of all pregnancies are considered high risk, and that's the case for the woman that you're about to meet.
And let me tell you that very few pregnancies are more complicated or more life-threatening than the story you are about to hear. Come with me to meet Heather, a local mom who gave birth to her 5th child. She explains why she's very glad she had her baby at Froedtert and the Medical College of Wisconsin Maternal Fetal Care Center. What is it that makes you proud to work here?
I think what's great about being at the Froedtert and the Medical College of Wisconsin is that we have this great access to multiple specialties, subspecialties that can help in the care of women, and also we have Children's Hospital, which is right connected to our birth center, so women will never be separated from their babies.
We're lucky to be part of a vibrant Milwaukee community and the extended area beyond, but what we understand is that we also have a responsibility really to the entire state of Wisconsin and the region at large too, and so we feel very privileged to have the luxury of all of the different bells and whistles on this campus as kind of the highest level of care for pregnant women in the state of Wisconsin.
When did you find out that there was a complication, and what was that complication?
So originally I was probably 3 days pregnant and I started to bleed. No one knew I was pregnant even. And so I called my OB and he said, we'll go to the hospital, we'll do an ultrasound, we'll do blood work. And we did all of those things, and I was in true pregnant, but it looked similar to maybe like my body was trying to get rid of the pregnancy. So I had to follow up. And I was still bleeding. So I went in every day for 2 weeks and got blood drawn. So they did a different type of ultrasound, and they discovered that my placenta at that time, so like 2 weeks gestational only, was low lining.
This is spectrums of abnormal placentation as you're going from normal to worse, and where the placenta is starting to invade the wall of the myometrium, or the wall of the uterus here. So in Heather's case, that was this case here, where the placenta is just invading through the entire wall of the uterus.
Wow.
But we're learning more and more about this particular condition, which has a lot of different names and can be kind of confusing, but the way that we try to make it more colloquial is to say kind of a sticky placenta, or what it means is adherent. And what's happened in the case of these sticky placentas is that this placenta acts more like a cancer than it does like a regular placenta. And so it grows, it invades into mom's tissues, it recruits and builds new blood vessels just like a cancer does, and actually can put moms and babies in tremendous danger, and why we have to make sure that we're really prepared to help take care of them at a moment's notice, but also at a planned cesarean like it was for Heather.
So my other OB that delivered all of my other children hand-picked Dr. Cruz for me. He had worked with her in a couple other of his cases that he was unable to follow through the whole pregnancies, and she did an amazing job. So he said, you're in good hands, like don't worry, she'll take care of you. She kind of talked to us like real talk, and she confirmed everything that the other doctor told us. And I said, well, what would you do? I said, if I was your daughter, what would you tell me to do? And she said, I would tell you to do what you think is right. And I said, do you feel confident in delivering my baby? And she said, yes. And I said, all right, we need a plan.
So what was the coordination of Heather's care like then?
We had multiple visits, just monitoring her bleeding, monitoring the placenta. But when it came time to delivery, we made sure that we had multiple subspecialties in the room, including OB anesthesia, trauma, interventional radiology, urology, other gynecologists, pediatricians. There were probably over 20 people in the room.
I was going to say, it sounds like a pretty crowded room.
Mm-hmm.
Yes.
A lot of people with a lot of knowledge about high-risk pregnancies and deliveries.
Mm-hmm.
They knew exactly what their jobs were, they knew exactly what they had to do, and they explained everything to me the entire time. So the day that we went in for my delivery, I had to deliver in the main OR at Froedtert.
And how long were you in surgery?
So, per my husband telling me and looking back, I was in surgery on and off for 2 days.
And there were complications with the surgeries, right?
There was, yeah. So as soon as they opened me up, I hemorrhaged out my entire bodies of blood within 15 seconds. As soon as I hemorrhaged, Chloe hemorrhaged, which we didn't know was Chloe because she was still attached to me through the umbilical cord. So, which is scary because then she lost blood and had to get blood transfusions, and then they had to do chest compressions upon delivery for her because she lost so much blood because I did.
I mean, if it wasn't for the team that we had in place and our ability to transfuse all the blood products that she needed, I mean, her life was critical in that procedure.
Is it a boy or a girl?
It's a girl.
How's she doing now?
She's perfect. She's A, family favorite, and B, for sure, the head of our household currently.
Looking back at everything you've been through, I bet you feel thankful that you were at a place that could handle something so complex.
Not even thankful. I mean, blessed beyond just blessed.
What a story, huh? The Maternal Fetal Care Center cares for women from before conception through delivery. They treat high-risk pregnancies and also offer genetic counseling and specialized testing and screening. To find out more about their services, you can check them out online. It's Froedtert.com/maternal-fetal-care.
And Froedtert is one of the main sponsors of today's TMJ4 Community Baby Shower. That's happening this Friday to help babies in your own community. It's easy. All you have to do is drop off new baby basics like diapers, formula, or new clothes to and local Century food stores.
So cool. I mean, Heather's story truly, I've never heard anything like it.
I haven't either.
Until I met her.
All I can think about is back in the day, she would not have survived.
For sure.
That kind of care wasn't available.
Well, and she knew so early on about this complication. I mean, sometimes your pregnancy goes along and everything seems fine and you don't realize that there's
3 days.
a complication.
Yeah, like 3 days she
in.
knew there was a complication.
But one of the things she mentioned that I thought was also interesting is that she was close enough to the Maternal Fetal Care Center that she could get there relatively easy. I think she's about a half an hour or so from this very intensive, this incredible team of experts to care for her and her baby. Many of the moms, because she was in a support group, had to drive huge distances to get there. But she had this team of people in place, and you have to think she probably would not have survived, or the baby, if she had maybe been somewhere else.
The moment she finds out it's a girl.
And she was crying, so cute. It was a great story.